to do more with less. And if you hire the right talent, you can accomplish these metrics and goals. But it's a roadblock. It's a barrier. The best way from access right now that we've had to pivot in our space is we've had to really rely on marketing from a virtual standpoint.
This is the Medical Sales Accelerator Podcast, featuring tips from top performers, delivered like a conversation over cocktails. Listen in to glean wisdom from the best of the best and accelerate your results for years to come. Now, here are your hosts, Zed Williamson and Clark Wiederhold.
Welcome to the Medical Sales Accelerator Podcast. This podcast is for you if you care about growth of sales, growth of market share. We all know there are thousands and thousands of patients out there who suffer, and sometimes they don't get access to the best treatment. And the medtech space has opportunity to treat those patients, and we want to increase connecting those two.
My name is Clark Wiederhold. I'm Chief Sales Officer for Trackable Med, formerly Trackable Lead Generation. But prior to my time with Trackable Med, I spent the last decade plus in the med tech space.
And I'm Zed Williamson, CEO of Trackable Med. For the last 9 years, we've been working alongside and with commercial teams in the med tech space. We drive patient demand through direct-to-patient advertising that's rooted in neuroscience and behavior change.
Frustration, lack of clarity, drop in production, those are all issues we've faced when we've been a part of teams that had a lack of leadership, a void of leadership, if you will. Any organization that's blown past barriers, that's had growth, has been the opposite. They've had that clarity of leadership. I think we can all agree that ingredient is more so impactful today in the environment we find ourselves in.
And that's why today we're really excited to have our guest. We're going to be discussing leadership in these challenging times. Our guest is Brandon Caraway, Sr., Vice President of Sales at Amniox Medical, an accomplished sales and marketing strategist with a proven track record for Fortune 500 and startup companies in the medical device sector. He's a 5-time President's Club winner and comes to us from Houston, Texas, where he lives with his wife and 4 children. Thank you so much for taking your time today, Brandon.
As VP of Sales over a national organization with Amniox, in this unprecedented market disruption that we find ourselves coming in or out of, whichever way you want to look at it, what surprised you the most from a leadership perspective?
Clark, that's a great question. The exciting thing about being one of the leaders in an organization is that you're pretty much surprised by everything, but you got to have plans. So, nothing comes organic as it used to. MedTech changes every day, whether it's a reimbursement landscape, access standpoint, which is really what's going on with COVID. So you have to be willing to adapt and have some secondary plans in place to move forward. I think what has surprised me specifically in the space I'm at in tissue tech is just what a hot space this is. It's just a great space that we're in. It is such an opportunity. But it's an opportunity where a lot of people really don't clearly understand what we're doing. So, I think about old school med tech sales where it was all relationship based, and there's still relationships are a key component. One thing I'm learning nowadays, if you want to drive reimbursements, you want to drive and get healthcare systems on your side, you have got to have the science down packed and truly have a product that's going to benefit the patient. And that's where we're at. I never understood that as much as I do now because there aren't reimbursements in this space. It is about the science and what's doing what's best for the patient. So you can build a plan around that and a process around that and build the relationships that run parallel. It's a pretty neat thing. But to recap, the most surprising thing is that you've got to have a secondary plan in place no matter what.
Do you find that, you see this opportunity and to you it's clear and obvious? Do you ever run across people, maybe their perspective doesn't allow them to see that opportunity and you've seen some kind of leadership drive and behavior change in that person?
I think you see a lot of different, first of all, it starts with the kinds of people you want to surround yourself with, number one, and what kind of culture you're building at an organization. And the way to build the culture right on the front end, clearly is by hiring talented individuals, but you got to build trust. You have to have that two-way communication to set the upfront proper expectations on what people are getting into. I'm never trying to sell somebody on the company or sell somebody an opportunity. I'm expecting individuals to come in our organization that have already done their research and due diligence on what the space is about. It's my job to make sure that they're going to be a great fit in what we're doing, and then try to remove as many barriers as possible to allow them to be as successful as they want to be. I mean, in a nutshell, that's about as simple as it gets.
Is there anything that you feel that people would be able to witness about either their situation where they may notice, man, there's a lack of trust, either management doesn't trust me or I don't trust the organization? What would you say are some, tell signs of lack of trust?
That's kind of what a lot of organizations are going through in this pandemic. You really have to rely on cross-functional collaboration right now. You have to sales has to rely on marketing. Marketing has to rely on sales. We have to believe that sales ops has our back and give them the best analytics possible to make the right decisions. They're not out there to just raise a quota. And I'm one of the young leaders who thought that at one point in time that sales ops is doing nothing but going to raise my quota. No. We're all in it together. And when I truly bought into the cross-functional collaboration, I understood that if we're all rowing in the same direction, then we're going to get where we need to be. And right now, at this point in time, you have got to do that. Access is a big issue. So if we're working with marketing and we're working with sales ops and R&D and everybody, and we know where to position our time and target, that's where we need to be. Because right now, you got to seize the opportunity. There's not as many as there used to be, right?
That's interesting. You mentioned access. How has that shifted outside of the obvious from 6, 9, 10 months ago?
Well, Clark, right now, we're operating at about a 60% capacity where we were. Still doing well. We're asked to do more with less. And if you hire the right talent, you can accomplish these metrics and goals. But it's still, it's a roadblock. It's a barrier. The best way from access right now that we've had to pivot in our space is we've had to really rely on marketing from a virtual standpoint. We've had to buy in and create excitement and engagement around webinars, around trying to get certain KOLs speak to other physicians and whatnot to relay the message about the space. The days where I could run in the OR with the rep and work with the rep in the field and press some flesh. They're just not here right now. I have trouble getting access into certain facilities. If I'm going to meet a KOL or a strategic individual or a possible customer, it's taking weeks and weeks of planning to get that individual out of the office because there's a lot of uncertainties going around right now. So we've really had to rely on the virtual component, fine-combing and fine-toothing emails to make sure that they're being read. Try the little things that I never thought I'd have to do as a sales leader. We're having to pivot to being more optimized on the virtual side and technology side.
It sounds like one of the shifts that your teams had to make, you and the other leaders in your organization may have had to make in coaching with the rest of your team is a step back towards some of the fundamentals. Is that right?
100% accurate there, Clark. We had to get to the fundamentals part. And what are the fundamentals? You got to totally define those because many times we overlook them. We forget about the blocking and tackling. It goes back to where am I spending my time? Am I targeting the right individuals? When I do have the opportunity, am I delivering the right message that's going to bring value to them? At that point, how am I going to move them along the sales cycle to where I'm not going to have to fight off another customer, a competitor, or fight a price war? I don't have the time because of access right now. So what we're doing to train our reps right now is to buy into how marketing is leading and how we are here to execute. I believe that the companies that have higher level leaders or anybody, the more touch points you can have to further log on to share about our technology, share about the vision of your company and your mission, the better off you're going to be. Because again, access is such an issue right now. Now you have to take advantage of that opportunity when you are in front of individuals. Before COVID, one of our customers might see 15 to 20 reps in a day. Yeah. So you had to do something crazy. Right now, if you have access, you're going to get more time. You're going to get the time. Maybe you only see 3 reps a day. So then this is your opportunity to share the vision, share the mission, find out what their goals and what a partnership might look like to help the medical space and the patient first and foremost.
Yeah, in a scenario where you get to take less cuts at the ball, you need to be sure that you're going to connect more often. And it's interesting that you bring that up because that makes me think of something that we have available for people. It's called the Behavior Change Blueprint. You can actually go to medicalsalesaccelerator.com, enter in your email address, and download the Behavior Change Blueprint. What is that? That is something that gives you specific actionable tactics, things that you can take today and start using today to make your conversations with your customers more effective. You can't see them multiple times a week. Make sure that time that you get them is absolutely the most effective as possible. It's the Behavior Change Blueprint, available at medicalsalesaccelerator.com.
Yeah, the most exciting piece about that tool that we've developed is the tools that we picked up from the best reps we're working with across the country and the successes that has brought them. I know when I've witnessed the most growth in teams I've been a part of, it was some of those actions were happening right there. Brandon, speaking of behavior and needing to shift with a 2 millimeter change of behavior of what you were doing 9 months ago versus now, you see a lot. You've worked in teams, you've led many teams, lots of different geographical responsibilities over your career. What are you witnessing? What are you seeing do well right now? And then what are you witnessing that is ineffective and not helping?
Well, it's ineffective not helping is throwing too big of a net out there right now. You're not going to be all and do all right now. You have got to be more strategic. And this ties into what you're just talking about with your new application you guys have, quite honestly. And that's not a plug. That's just the facts. And I'm sure that tool is dynamite. Diving deep into the account is never more important than it is right now. As reps, we've always thought this, and I've been guilty of this as well, that, I don't know if my customer can use more of our technology. Well, I'm here to tell you they can. They just don't know how. They don't know where to apply it. And that's what we're having to do right now. We have to extend our vocabulary and articulate messages in a different way for a customer to understand how they can use our technology within compliance with the guidelines, but open up those applications to continue to give patients the best symptomatic relief. And, it's very simple. It's just diving deep with accounts. I still believe that the office manager is as important as the physician. I hope no physicians listen to this podcast, but, the office managers are the ones that have let me into accounts back in the day when I was carrying the bag.
Sure.
Procurement in the hospital system right now is never more important. If you want to get into a case, you have to go through check-in to get in the hospital systems right now. Access is so limited, but if you're in good procurement and you're doing your job and you're checking inventory and you're making their life easier, and they know that you're there to bring value to their facility as well. Because let's not get it twisted. These facilities and offices and hospitals, they're there to treat patients, but they're also a business. They've got to make money. So they have challenges too. We don't want to be a burden on that. We want to make it more efficient, easier for them so they can focus elsewhere, right? And as an individual and a leader in the med tech sector, it's my job and responsibility to continue to make them more efficient.
Brandon, I was fortunate enough to witness some of your leadership with teams that you were leading at times during certain natural disasters, hurricanes specifically, teams in Houston, teams in Florida. Are there any lessons throughout there that you've brought with you into this current disruption in the marketplace that have been valuable for you?
Man, there's a lot of lessons I've learned, Clark. First and foremost is that, and I've said this many times, part of my philosophy is people first. I mean, in the day, we want to hit numbers. We want to win. We want to do all these great things, but there's families and there's certain people that are impacted. So you got to keep that human element to you when you're making decisions. You can't control everything. And that's imperative. It's imperative to retain great talent. It's imperative to let people know that this is the culture they want to belong to. So what are some things I've learned through disasters like hurricanes and floods and pandemics and all other things you can think of? Number one, you got to keep a human element to yourself in all your decisions, to know that your decisions are impacting families. Somebody in a hurricane area is, they're not going to hit quota. I've got to find a way to deliver that number still. So you might call on some seasoned reps who are hooking and booking, and you say, hey, I need you to pick up the slack. Can you do this for me? Yeah. And normally when you have the right people on the team, the right culture, they're like, I got you. You just let me know how much and I got you. I'm in it. I'm in it as a team. So those are things I've learned. You bring the right people in, you're going to get through the tough times. Keep that human element. I've always said the philosophy, or you said this many times, you can control what you can't control. And this was told me a long time ago. It's kind of funny because I used to take my work home with me, and I love taking work home with me. So anybody says about work-life balance, that's BS. I don't have a work-life balance. My family knows what I do. My wife knows what I do. My kids are asking me about how cases are going. what technology is going on. It's a part of it. It's just how you bring it home. And what somebody had told me a long time ago, and when I realized this, and it made my whole life, I'm really just not that important. The life is still going to go on. The med tech sector is not going to close because I'm stressed out or I can't figure out how to do this. It's still going to happen. It's here before me. It'll be here after me. And when you have great talent on your team, they'll pick up the slack. One of my mentors taught me that quite some time ago.
We as humans, sometimes we trick ourselves into thinking that something's important. You had mentioned that came from a mentor that said that to you. And we all, in lives of success, we always think about the people who helped us get there, the mentors, the nuggets. On the other side, sometimes we still hear some crazy advice, something that you're just going, wait, what the heck are you sharing with people? Have you come across any of that in this time or space where you're just going, wait, why would you ever tell someone to do that?
The people I surround myself, quite honestly, I've been very selective and picky. I'm a more the merrier, bring everybody in, but my circle is tight because I try to surround myself by like-minded individuals, and I want to bring as many people as I can. I want people to have the values, the same goals. Now, I've heard some pretty funny advice in the past, and some people it's great. For me, it doesn't work. Like one, quite honestly, for me, I've heard many times, Brandon, just sleep on it. I'm not a sleep on it kind of guy. Telling me to sleep on it means I'm going to stare at the clock for 20 hours until I go act. So I guess for me, sleep on it doesn't work as well because one of my mentors, we talked about this earlier, it's Tom Williamson. Y'all know Tom very well, and I'm very open about him being one of my mentors in my life. I have a few of them. He's always told me, trust your gut. We're going to have to make decisions in life. As leaders, you're going to have to make decisions. They're not always going to be right. But if you trust your logic and you trust your gut and you've done some research beforehand, what's going to change for me in the next 20 hours that I'm already prepared for? Not much. Unless I get a little emotional and I don't write an email out and I'll save it. And then if I still feel the same the next day, I'll fire away.
There you go.
Yep.
You're a man of action. I love it, Brandon.
Well, man, I really appreciate you taking the time today. This has been some great insights. I know everybody is in a position in their space where they're dealing with things that they've never dealt with before. And you taking the time out, spending it with us on the Medical Sales Accelerator podcast, I got a lot of gratitude for that. Really appreciate it. If you like the show, go ahead and give us a rating, subscribe, go to medicalsalesaccelerator.com and sign up for the Behavior Change Blueprint and also our newsletter where you'll get upcoming notices of shows to come.
If you have suggestions about guests, suggestions about topics, hit up the website, medicalsalesaccelerator.com, and send us those. We are here to build out a community of like-minded individuals that are looking to improve and blow past obstacles.
That's right. Thanks a lot for your time.
Have a good one. Thank you, Brandon.